As we age, our bodies go through various changes that can catch us off guard and be difficult to handle. One of the most challenging changes is a decline in balance. Many people don't pay much attention to their balance until they start losing it. But have you ever considered why this happens? What if I told you that some of the medications you're currently taking could be linked to your persistent balance issues? It's ironic that the very medications meant to help us can actually increase our risk of falling over. Unfortunately, this is the case with many common drugs. In today's video, we will be shedding light on 10 medications that can cause a loss of balance. Make sure you stick around until the end, because number 6 is one of the most common medications that not many people are aware of. It's alarming to think about how many people unknowingly put themselves at risk due to their medications. It turns out that quite a lot of people are affected. While there are dozens of drugs that can cause balance problems, some are more prevalent than others. Do you or someone you know struggle with balance issues? We're curious to know where in the world you're from. After watching the video, feel free to drop a comment below so we can connect and get to know each other better. Let's dive into the 10 medications that are particularly likely to make you unsteady. Blood pressure medications. This is perhaps the largest category of medications that can cause balance issues. Almost any drug that lowers your blood pressure has the potential to cause dizziness. The logic behind this is quite simple. If your blood pressure drops too low, especially when you stand up quickly, not enough blood reaches your brain. The result is feeling dizzy or lightheaded. Diuretics, water pills, ACE inhibitors, and beta blockers are the most common culprits in this category. These medications are extremely common, and millions of people take them every day. For most individuals, the benefits of these drugs far outweigh the risks. However, it's important to acknowledge that the risks are real if you're on blood pressure medication and you start feeling dizzy, especially when you stand up. It's crucial to inform your doctor. They may need to adjust your dose or switch you to a different drug to mitigate the balance issues. Antidepressants. While depression itself can cause balance problems, the medications used to treat it can also contribute to this issue. This is especially true for a class of antidepressants known as SSRIs, selective serotonin reuptake inhibitors. Medications like Prozac, Zoloft, and Paxil fall into this category. The exact mechanism behind why these medications affect balance isn't entirely understood. However, it appears to involve changes in how the brain processes sensory information. Some individuals describe the sensation as feeling like they're walking on a boat. Once again, it's important to note that for many people, the benefits of these drugs outweigh the risks. Depression is a serious illness, and SSRIs have proven to be helpful for millions of individuals. However, if you're taking an antidepressant and you start feeling off balance, it's worth discussing this with your doctor to explore possible solutions. It's crucial to be aware of the potential side effects of the medications we take. Maintaining balance is vital for our safety and well-being, especially as we age. By staying informed and having open conversations with our healthcare providers, we can work together to find the best solutions for our health. Are you aware of the potential risks associated with certain medications that may affect your balance and coordination? Medications like benzodiazepines, commonly prescribed for anxiety, work by depressing the central nervous system, which can have a calming effect, but may also impact your ability to maintain balance and coordination. This is especially concerning for older adults, as studies have shown that those taking benzodiazepines were 44% more likely to experience a fall resulting in injury. The risk is highest when you first start taking these medications, or if you increase your dose, so extra caution is necessary during the initial weeks of treatment. In addition to anti-anxiety medications, sleep aids can also have an impact on balance and coordination. Prescription sleep medications and over-the-counter sleep aids work in a similar way to anti-anxiety medications by depressing the central nervous system, potentially causing grogginess and impaired balance even after waking up. Non-drug approaches such as improving sleep hygiene, cognitive behavioral therapy for insomnia, and relaxation techniques can be very effective for those struggling with sleep issues and may be worth trying before turning to medication. Surprisingly, even common over-the-counter antihistamines can affect your balance, particularly older ones like Benadryl. These drugs work by blocking histamine, which not only controls immune response but also regulates wakefulness. As a result, they can cause drowsiness, leading to impaired balance. If you need to take an antihistamine regularly, it's important to discuss with your doctor which option might be best for you. Lastly, it's important to be aware that pain medications, both over-the-counter and prescription opioids, can also potentially cause dizziness or affect coordination. Opioids in particular can impact balance and coordination by binding to opioid receptors in the brain and causing drowsiness and impaired judgment. Even common pain relievers like ibuprofen and naproxen can potentially cause dizziness in some people. It's crucial to be informed about the potential side effects of medications that may affect your balance and coordination. If you have concerns about any medications you are taking, it's important to consult with your doctor to discuss potential alternatives or strategies to mitigate these effects. Your safety and well-being are of the utmost importance, and being proactive about medication safety is essential for maintaining a healthy and active lifestyle. Balancing the benefits and risks of medications is crucial, especially for those with diabetes, heart conditions, Parkinson's disease, or those in need of antibiotics. These medications can have side effects that may affect your balance and increase your risk of falls. For individuals with diabetes, certain medications, such as insulin and sulfonylureas, can cause low blood sugar, leading to dizziness, confusion, and loss of balance. It's essential to monitor your blood sugar closely and recognize the signs of low blood sugar to prevent potential balance issues. Heart medications like digoxin and antiarrhythmic drugs can also impact your balance due to dizziness and vision changes they may cause. It's important to be aware of these potential side effects and discuss them with your doctor. If you experience any balance problems while taking these medications, Parkinson's medications, while overall beneficial, can also have side effects that include dizziness and impaired balance. If you're prescribed these medications and start feeling unsteady, talk to your doctor to explore possible adjustments, alternative medications, or ways to manage these side effects. Even antibiotics can play a role in balance problems. Certain antibiotics, particularly a class called aminoglycosides, can damage the inner ear, leading to permanent balance issues and hearing loss. If you're prescribed these antibiotics for a serious infection, be mindful of this potential side effect and discuss it with your healthcare provider. It's important to note that the goal is not to frighten you off your medications. Most often, the benefits of these drugs outweigh the risks. However, it's essential to be aware of potential side effects and communicate with your doctor. If you experience any balance-related issues, your doctor may be able to adjust your dose, switch you to a different medication, or suggest ways to manage the side effects. In addition to medication management, there are steps you can take to reduce your risk of falls, regardless of the medications you're taking. Regular exercise can improve your strength and balance, while a balanced diet and staying hydrated can help maintain your overall health and prevent dizziness. Making your home safer by removing tripping hazards, improving lighting, and installing handrails can also significantly reduce your risk of falls. By being proactive and staying informed about the potential effects of your medications, you can work with your healthcare provider to find the best balance between managing your condition and minimizing your risk of falls. Are you tired of feeling dizzy or off balance when you stand up too quickly? It's time to make a simple change that can have a big impact on your health. Stand up slowly to give your body the time it needs to adjust to position changes. But that's not all you need to be mindful of. Did you know that alcohol can interact with your medications and increase dizziness? It's important to be careful and avoid drinking alcohol if you're taking any medications that may have this side effect. Speaking of medications, as you age or if your health changes, it's crucial to review your medications regularly with your doctor. Older adults are more likely to take multiple medications, and these drugs can interact in complex ways. By having regular discussions with your doctor, you can ensure that you're taking the right medications for your needs and reduce the risk of balance problems. Another factor that can contribute to falls is poor vision. That's why it's essential to have your vision checked regularly. By maintaining good visual health, you can reduce the chances of accidents and maintain your balance. It's important to stay informed and proactive about your health, especially when it comes to potential side effects from medications. Don't be afraid to ask questions and seek information about the medications you're taking. Understanding how they may affect your balance is crucial for your well-being. To conclude, the risk of balance problems from medications tends to increase with age. Older adults often take multiple medications, which can interact in complex ways. Moreover, our bodies process drugs differently as we age, making us more susceptible to side effects. By staying informed and proactive about your health, you can minimize the risks associated with medications. If you have any experiences or questions about balance issues and medications, we would love to hear from you. Share your thoughts in the comments section below. And if you found this information helpful, don't forget to like, subscribe, and share with your loved ones. Together, we can help others stay informed and maintain their health. Have an awesome day, and remember to stay balanced.